Hey everyone, for those of you who don't know me, my name is Dr. Corey Sellers. I'm a chiropractor and I specialize in rehab and active care. I'm a certified primary spine practitioner and I'm located centrally here in Orange City, Florida. So the topic today, this is something that we get a lot of questions about in our office, is what are exercises that we should avoid when dealing with a disc bulge or a disc herniation? And to preface this, I'm talking more about acute pain, so something we've been dealing with maybe over the last few weeks or maybe a month or two. Once we start to get into the chronic pain world of disc injuries, you do want to start to reintroduce movement to these things. So these exercises or these guidelines are specific to more acute type of injuries. So the big thing we know about disc pain, and when I say disc pain, whether you have an image or not, typically we are looking at flexion-based pain, so pain that hurts to bend over entire shoes, pain when we're getting out of the chair, maybe in the mornings when we roll out of bed and we twist to get out of bed, we get a sharp shooting pain. It may refer into the glute, it may refer into the hamstring. These are the typical, pretty common presentations of this type of pain. So the first one that people ask about, because we always want to strengthen our core, are sit-ups. So we get a lot of patients who hurt their back, their provider tells them they need a stronger core, so they go to the gym, they start hammering sit-ups. And so when you think about flexion-based pain, or pain that's worse with bending forward, and then you think about the sit-up, all the sit-up really is just a bunch of repetitive flexion to the low back. And while this is fine later in care, early on it can be counterproductive for what we're trying to do from a healing standpoint. So with acute pain, we're really just trying to calm things down as much as you can with movement, and then once things feel a little bit better, then we start to rebuild those movements that we've been avoiding for a certain period of time. So rather than doing a sit-up, one of my favorite exercises to do is going to be a dead bug. And the great thing about the dead bug is it keeps the spine in a fairly neutral area and allows you to move the extremities around the spine to ultimately allow you to get a good workout, get movement in the spine, but also not irritate the disc too much. So what that's going to look like, and so the way we teach this to our patients is we'll have them start on the back, and we like to start with just the legs first to see how that's going to feel on the low back. But we're going to start here. We grab ourselves at about our belly button line, and I want you to think about pinching, but then pressing your stomach. So I want you to pressurize your stomach actually into your fingers. Create tension, keep that tight, and then we're just going to lower one leg at a time, tap the floor and come up. Lower, tap the floor and come up. Tap the floor and come up. And now if this is easy, we can add the arms in to make it a little bit more challenging. So we're going to go with the opposite arm from the opposite leg and back up. And back up. And I like to do anywhere between 6 and 10 on each side, depending on the fitness of the individual. The biggest thing is this should not hurt. If any of this hurts, obviously talk to your provider. If we're stabilizing properly, we can generally do this at any stage in an acute disc injury, whether it's really acute or we've been dealing with it for some time and things are calming down. The next exercise that we get a lot of questions about is the Russian twist. And the Russian twist is going to be on your side, and we're just tapping from side to side. Sometimes you'll see people grab a weight and they'll try to load that. Great exercise for some people sometimes, but not when you're dealing with acute disc injury. Discs generally don't like flexion and they usually don't like rotational movement. So if we put ourselves in that position and we load it and we start twisting, a lot of times this will set things off and irritate the low back. If this is a problem, we do want to start to reintroduce this later on in care, but early on, I would stay far away from this exercise. So rather than doing a Russian twist, I like to go back to the dead bug, and you can still get some lateral core work in without rotating. And so what we do is we'll grab a band, we'll have some pressure to the side, and then we'll do that same breathing pattern and load ourselves into the dead bug. And once we do so many on one side, we can swing around and do it on the other side. The dead bug is a great exercise and there's many variations. to challenge different portions of the core, especially early on when we're dealing with acute pain. So the last thing we get asked is stretching the low back or stretching the hamstring. Sometimes we get tight hamstrings associated with our low back pain, so there's a tendency to want to bend over, touch our toes, and stretch things out. And really what we know is things feel tight because muscles are tight and spasming, guarding an injury, right? So when we go back to that disc pain, we know flexion is aggravating. So if we do this, even if it feels like it's doing something to the muscle, oftentimes it is actually creating more sensitivity in that low back. So we'll generally pull flexion-based stretching off of our patient's care plans early on. And what we like to do instead, if we are getting some tension in the back of the leg or in the hamstrings, is we'll just do a simple nerve glider instead. And what that'll look like is, so we don't want to do this because we're rounding the low back. We want to keep ourselves upright. We'll go up until we get a good pull in the leg, and then we'll look up at the same time and then come back down. Go up till we start to get a good pull in the back of the leg and come back down. If it's too hot in one leg or the other, just do the other side. You can still get some neural stretching just by stretching the contralateral leg. And really simple exercise just to start to get some mobility within the nerve roots and in the spinal cord. These aren't all forever exercises. These are just good starting points, especially early on with a disc injury. If this was helpful or if you have any questions, drop us a comment. We're always looking for ideas for new videos, new ideas for things to post to help people out with. Like I said, this is just something that we see quite often in our office, and we get a lot of questions about this. Thank you.